Just one
Okay.
moment. Yeah.
There we go. Okay, ask and you shall receive. Good morning, everyone. Welcome. This is our March 8th meeting of the Healthcare Workforce Committee. Thank you all for joining us. Committee members, again, if you could please put a CM in front of your name, that will help us identify when we're doing introductions. And we'll go ahead and get started with that. Before we do that, though, I would like to just remind us of our definition of health equity. I like to go over that before we get started. And I'm going to read that, and I think Jamie's going to put it on the screen. Thanks, Jamie. So again, Oregon will have established a health system that creates health equity when all people can reach their full health potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, age, gender, gender identity, sexual orientation, social class, intersections among these communities or identities, or other socially determined circumstances. And of course, achieving this health equity requires the ongoing collaboration of all regions and sectors of the state, including tribal governments. And we want to address these two bullets here: the equitable distribution or redistribution of resources and power, and also recognizing, reconciling, and rectifying historical and contemporary injustices. So thank you for that, Jamie. And we will go ahead and start with introductions. Committee members, I'm going to call your names, and if you could please go ahead and introduce yourself, and we'll get started. And I'm going to start with Aaron.
Good morning, everybody. Aaron Hines, CEO at Yellow Hog Tribal Health Center.
Thank you. Oh, Mark, I think we were going to ask our question of the committee members this morning. Thank you for reminding me. Can you remind me what we were going to ask them, Mark?
Sure. You had said, Laura, especially given the number of new members of the committee and people still getting acquainted with one another, to take the opportunity for a minute or two, say anything about people's background that you'd like to share and what you're especially interested, hoping to contribute to the committee and why you're here.
Okay, perfect. Thank you. I just didn't have my notebook in front of me. Actually, I'm going to start with myself before we move on. So my name is Laura McKean. I'm the Senior Director of Oral Health Services and Community Engagement at AllCare CCO. And I've been on this committee for a long time, and I have really enjoyed the work that we've done. I've also enjoyed, and one of the reasons I wanted to be on this committee was to bring oral health into, I don't want to say the limelight, but in my case, I would say the limelight, because I think sometimes oral health is kind of forgotten. So it's really a passion of mine, and one of my goals is just to make sure that oral health remains just as important as physical and behavioral health. And I know my oral health colleagues will agree with me on that. So I am going to go ahead and we'll start over, and I'm going to start with Aaron. And Aaron, if you already introduced yourself, but if you could just share with us in a few words why you joined the committee.
Sure. So I've been on the committee now for a couple of years, I believe, and I'm currently the CEO at Yellow Hog Tribal Health Center. But prior to stepping into this role, I was the HR director, and I think just being in that field and wanting to look at best practices for how we could recruit and retain healthcare professionals, this committee was right up that alley. And so I know I've learned a lot from what we've been able to do and share on this committee, and take some of that and apply it here at what we're doing at Yellow Hawk. And I enjoy working with everyone here. It's always good to see and hear what others are doing in other locations, because I know we're all, especially with pandemic, we're all still trying to figure out how recruiting and retaining healthcare professionals post-pandemic is how we can do that and share resources.
Great. Thank you, Erin. And let's go to Elena.
Hi, good morning. My name is Elena Shablaski. I use she, her pronouns. I am a general dentist most of the time and also a dental director at a federally qualified health center called La Clinica in Medford. This is my third year on the committee, I think. And I joined because I really wanted to see how us as a workforce in Oregon and OHA in particular was putting things like the equity statement and our values into action, and really making sure that our voices align with the values that we say we hold, particularly when it comes to equity and diversity. I have lots to learn in that area and am always learning from everyone in this committee. And then like Laura, I also am always ringing bell for teeth and reminding folks that the mouth is connected to the body. So making sure that dentists and dental assistants and hygienists and all of our awesome workforce are included in, and dental therapists are included in the conversations we're having here.
Perfect. Thanks, Elena. And let's go to Daniel.
Good morning, everyone. I'm Daniel Ornelas. I work at the Virginia Garcia Memorial Health Center, which is a federally qualified health center, and I serve as a dental program manager. I have been in the oral health field for a little over 15 years now. And one of the reasons I joined the committee was, first of all, I wanted to become educated and having a global perspective in terms of the state's infrastructure and the ability to provide health services to our community. From an oral perspective, I'm really interested in improving the access for underserved populations with an emphasis on health equity. Thank you.
Thanks, Daniel. And Gabby?
Good morning, everybody. My name is Gabby Carrillo. I am the Director of Clinical Placement at Sumner College, as well as the MA Program Director. And I, just a really quick story, I came to the United States when I was 6 months old, undocumented, grew up only speaking Spanish, was my parents' interpreter when we went to clinics. And growing up, it was me as the interpreter for my family members. And I went into healthcare with that idea of diversifying the workforce so that we could have more people who could speak the language of our patients. And so that's why I'm here, to be able to be part of that and continue to diversify the workforce. Thank you.
Thank you, Gabby. We're glad you're here. And how about Judy?
Hi, I'm Judy Geiger. I'm the Vice President of Patient Care Services at Columbia Memorial Hospital in Astoria. I joined the committee because I'm passionate about having enough of a healthcare workforce and the right healthcare workforce in the right places to make sure that all patients in our state can be taken care of. And I live in a rural setting, and so we have major challenges out here from the rural standpoint.
Thanks, Judy. Larissa?
Larissa Mejia Medina. I work at Road Community Health and FQHC here in Southern Oregon. And I also joined the committee to help bring some attention to our workforce, our providers, people who are providing care, just with the recent, I don't know if it's a trend, but just the recent state of all of the healthcare employees who are just really overwhelmed and burned out, and just a way to help protect our clinicians and help provide an environment where they can provide equitable health care to people, to everyone. And also similar experience as Gabby. I'm Mexican. I was born in Mexico. I came to the United States when I was 3.5, and I've interpreted for my parents my entire life. I still go to their medical appointments and are part of that. And I just also want to be able to make sure that everyone's able to receive the same care, no matter where they're from, and they all have access to care. I've seen what happens when people don't have the right access to care, and delayed health care and delayed health outcomes and bad health outcomes. So I want to help prevent bad health outcomes for our patients from all parts of all walks of life.
Thank you, Larissa. Bhavesh?
Yeah, hi. Good morning. So I'm Bhavesh Rajani. I am an associate medical director at Pacific Source, and have been working in the CCO world for about 6 years. I have a background in family practice, and so working through in the Providence system, I noted, just how difficult it was for providers to survive without additional skill sets operating in their office, and realize that, we need to expand the availability of an interprofessional workforce in a primary care setting, not only to support that quadruple aim for the providers to reduce their burnout, but also to improve accessibility and satisfaction for the members so that we got better quality of care for our community. And my own personal background, I was a refugee at a young age, and managed to escape some difficult times with basically my family into a new world, and I had to do the same kind of interpreting and support of my my parents, who still to this day are very skeptical of and not trusting of systems. So we need to make sure that we create comfortable and trusting environments in our primary care settings, and allow for that better interpretation for our members, so that we can serve everybody in our community and consider their social needs as well as their medical needs. Thank you.
Thank you, Bhavesh. Alicia?
Hi, everyone. I apologize. My computer is acting a little wonky, so my screen isn't on. And I also just had a baby and did not have did not have a chance necessarily to prepare anything very deep or in depth for this, but wanted to make sure I could still attend the meeting today. But I'm Alicia Jackson. I'm the medical director for the OHSU Health South Hillsborough Clinic, and the associate program director for the Family Medicine Residency Program, which is a brand new program that is trying to educate new physicians for our community. And I joined this committee primarily because diversity is extremely important and something that I am passionate about. I'm born and raised from the island of Hawaii and grew up among a very diverse population. And not until I ventured off to the mainland did I start to kind of understand that diversity is not something that everyone is accustomed to. And I've understood the major importance of having people who are diverse around you, how much richness and depth and importance of information that you can get from working with people from all different types of backgrounds. And so with a very strong focus on residency education and training our future healthcare workers of tomorrow, I've really been excited to be a part of this committee to learn from everybody else and all of these amazing people who are in all different parts of the state.
Thank you, Alicia, and congratulations on
Thank you.
Congratulations. How about Ian?
Hey, I'm Ian Strauss. I use he, him, and L pronouns. I am the Special Projects Coordinator at Whitebird Clinic, a federally qualified health center in Eugene, Oregon. And I have been a member of Whitebird now for 22 out of the last 42 years. I have seen our populations of, we're a healthcare for the homeless clinic. So I have a strong interest in making sure that everybody, no matter their circumstance, has access to healthcare. I spent 10 years as a crisis intervention supervisor and another 10 years or more actually coordinating our primary care medical services. So looking at who we are and how people perceive us as we approach the healthcare system has been an interest of mine for many years, and how we can all provide a service that draws people in and makes them comfortable, or at least more comfortable, is a key feature to any of us being able to provide effective healthcare. And so that's the reason I came to this committee, was to see how that was being applied on a statewide level, and really to look at how systems are being designed to make equity a part of our conversation. That's all. Thanks.
That's a lot, Ian. That's great. Thank you. How about Coy?
Hi, good morning, everyone. I'm Koi Vu. I'm my pronouns are she, her, hers. I am the executive director of the Coalition of Community Health Clinics, serving and supporting 17 community health clinics here in the Tri-County area. I've been with the committee for just a few months since the beginning of the year. And one of the reasons why I did join this clinic, first of all, is to be in the presence of all of you. I'm very much in awe of the knowledge and expertise of the space in this room, and really to also uplift the voices and making sure that our community health clinics uplift the voices of communities of color, and making sure that our community health clinics who are serving our most disadvantaged communities, as well as our BIPOC and culturally specific communities, are in this conversation as far as workforce at a system level. I am most particularly interested in making sure that our BIPOC providers and workforce of all levels are supported, and also that our systems that our health system create a space where they are not only supported, but also there is a space for continued mobility. As many of folks here have talked about their background and experience supporting their family members. I am also a refugee who supported my parents, continue to support my parents in navigating the health system. Interpretation and language access is also a key piece in making sure that folks are able to access the information that they deserve, and get the health care that they also deserve as well.
Thank you, Coy. And Dr. Hemmings.
Hi, I'm Dr. Rosemary Hemmings, CEO, owner of Black Therapists and Company. And I joined this committee because I think it's important that everyone has access to a provider who looks like them and or who shares similar lived experiences. I think that's an access to care issue. And there are inequities that exist within our healthcare system as it relates to healthcare providers who identify as Black, Latina, OX, and Indigenous, and especially in the mental health realm. So that was my reason for joining this committee.
Thank you, Dr. Hemmings. And Bob.
Hi, I'm Bob Lieberman. I live in Grants Pass, Oregon. I've been on the committee for 5 years, I think. So I'm one of the long timers, I guess, at this point. I actually originally applied for the Health Equity Committee, and Mark got in touch with me and said, well, that wasn't going to be happening, but there was an opportunity to join the Healthcare Workforce Committee. And in my career, I was CEO of a children's, young adult, and family mental health organization down here in Southern Oregon for 30 years. And 10 years before that, I helped found the organization. So I was there for 40 years. And what we did with the workforce really made a difference, how we tried to support the workforce and manage the workforce. So it's always been, and actually we were written up nationally for what we did for staff in children's mental health. So this was a natural fit for me in many ways. And since joining the committee, a particular point of focus for me has been on the importance of bringing traditional health workers and peer support specialists, the whole category, all the kinds of positions that are included in traditional health workers into the workforce in a more robust way. And I'm working on that nationally in children's mental health and residential treatment, bringing in parent peer support specialists, youth peer support specialists. In my organization, between 15 and 20% or so of our client-facing staff were peer support specialists at the time that I left. And our people we were serving and supporting said that it really, really made a huge difference in their journey towards healing the trauma and the mental health challenges that they'd experienced. So that's a kind of a renewing point of focus for me, and really happy to be part of it. And I just want to say thanks for this opportunity. We usually don't have these kinds of introductions. As a matter of fact, I don't remember one for many, many years where we're just talking about ourselves and getting to know each other. So I think it's great when we have an exercise to say, why are we here? Why are we doing this as individuals and as a team? So thanks for making that happen, Laura.
Well, I can't take all the credit for that, Bob.
Okay. I figured.
That's a really, I think Mark, you suggested that. And I think it's really good to do this because, as you say, Bob, we attend these meetings and we get to know each other, but that's some of the things that we've heard today. I've not heard from committee members before. So I appreciate everyone being willing to share, and some of us be a little vulnerable when we're sharing about our lives. So it's really great. So thank you. And I think I got all the committee members. Is there anyone that I missed? Okay, I don't think so. All right, perfect. So we do have quite a few OHA staff on the line with us today. And instead of doing all the introductions, I'm just going to go ahead and introduce everyone for the OHA staff. We have staff that are attending and staff that are presenting with us today. So as far as the OHA staff, of course, we have Mark Overbeck, who's our lead staff for this committee, and we appreciate everything that he does. And Jamie is, we couldn't do this Zoom without Jamie. So thank you so much for Jamie, for everything you do. We also have John McElfresh with us, Liza Root, and Chris DeMars with us. And we have several staff from the primary care office that are going to be presenting today. And that would include Neelam Gupta, Leah Festa, Joe Boyd, Joe Bergeron, Melissa Yates, and Lauren Neely. And forgive me if I mispronounce your names, but I think I've got it. Couple other presenters we have with us, Phil Schmidt and Judy Guzman. And we have, of course, Andy Davis, Meredith Helling, and Sarah Grusing. And is there, I don't think I missed any of us that are presenting today, Mark.
You haven't, I noticed also Piper Block is here, and also Vitalis Ogbiyama. I hope, Vitalis, I said your last name correctly, but I saw you on the screen also. Welcome.
Perfect. Thanks, Mark. And thanks everyone for being with us. So we need to look at some minute summaries from January and February. And we do have 3 different meeting summaries that we need to approve the minutes for. I hope everyone had the chance to review those. They were sent out in the packet by Mark. The first one is the special meeting that we had on January 4th of 2023. And are there any corrections or additions to those minutes for that particular meeting? Not seeing any hands, not hearing any voices. Okay, can I please get a motion to approve the January 4th Special Healthcare Workforce Committee meeting minutes.
So moved.
And a second. Thanks, Judy. Okay, those minutes will be approved. The next set of minutes is for the January 11th Standing Healthcare Workforce Committee meeting. Those minutes, again, were included in your packet. And are there any additions or corrections to those meeting minutes? Okay, if none, can I get a motion to approve?
So moved.
Thanks, Elena. And a second?
I second.
Thank you. And the last set of minutes are for the February 8th, 2023 special meeting that we had. Any additions or corrections to those meeting minutes? Hearing or seeing none. One final motion to approve those minutes.
I will make the motion.
Thank you, Gabby. And a second? Thanks, Ian. All right. We've got that done. Thank you. All right. So we are now at the portion of the meeting where we do take public comment. I don't know if we had anybody signed up for public comment, Jamie or Mark, or if there's anyone on the meeting today that would like to give public comment. And if so, I just want to remind everyone on the meeting that we do appreciate all the public comment that we get. And we invite you to share with us now your public comment. We ask that you keep it to about 2 to 3 minutes. And if you need to, you can also submit public comment by email too. Is there anyone on the meeting today that would like to share any public comment with the Healthcare Workforce Committee today? I'm looking for hands and I'm not seeing any. Jamie, we didn't have anybody that signed up, did we? No. Okay. All right. Couple of things I just wanted to share with the committee. It's not public comment, but I'm going to share it anyway. This is just a personal note, and we have been doing so much work around workforce and diversity and resiliency. Mark knows and Neelam know this, the past couple of days, my mom had knee replacement surgery at Rogue. And I know all my Southern Oregon colleagues, and Brent, I see you on the call, so I know you can appreciate this, how challenging it is at the hospitals down here in Southern Oregon because of staffing. And I will say, we were in short stay most of the time, and the diversity of the workforce down there was non-existent. And so it really got me thinking about, how we can potentially change that. So that was one thing. And the second thing was beds were short, of course, because we stayed in short stay overnight. But I will say that the workers, the nurses, the doctors that we encountered there, I know that they are overworked. However, there was not one time when they did not have a smile on their face. And they were so nice and just very helpful. And so, it made me want to work on the resiliency piece so I can keep them that way. It just felt really, it felt really good to know that, I know they're overworked and I know how things are there, but the fact that they still were so kind and had such a smile on their face and were so helpful and willing to help really did my heart good. So I just wanted to share that with you all this morning because it kind of hit me hard because I know how hard those people work. Any comments or anything that anyone wants to share before we move on?
Laura, hi, this is Bhagavati, and I'll just chime in response to what you were just describing. And it doesn't sound like it affected long-term care particularly, but I know Lines for Life has recently put together a coping with stress affinity group for long-term care workers, you know, to address their stress. So I'll share it with Mark and maybe he can send it out to others, but there are so many opportunities for, regardless of the audience, long-term care acute, to help support the resilience. And so I appreciate you calling that out, and I'm sorry about the experience for your mom, but you know, sometimes we then get firsthand experience and kind of seeing and then maybe bringing more attention to it. So thanks for sharing your story.
Absolutely. Thank you, Papagati. Yeah, it was interesting. And again, the diversity piece really hit me hard too. And it's because of the work that we're doing here, and because, you know, we're learning about how to have a more diverse workforce. And I really didn't see that here at Rogue. So just something that I was thinking about. And I saw, Jason, that you are here with us. So if you could please introduce yourself and give us a couple thoughts about why you joined the committee.
Sure. I'm sorry I'm late, first and foremost. Hi, everybody. It's good to see y'all. My name is Jason Johnson. I use he, him pronouns. I am a program dean at Portland Community College. I support about half, maybe a little bit more, of the healthcare programs at the college, both on the credit side and all of the non-credit programs as well. Why, and the prompt was why I am interested in joining the committee. Is that correct?
Yes.
Okay. Well, I've been on the committee now. This is, I think, my 4th year. And I joined because, first of all, I want to make as large of an impact on my community in Oregon as possible. It's why I'm into healthcare programs. It's why I've been involved with healthcare programs for over a decade now. And so this seemed like just a natural extension of how to make that impact. I really enjoyed being on the committee. I think it's, you know, making a positive impact on Oregon, and it's always getting better, and we're looking for ways to improve things. So it really fits kind of where I see my career trajectory, and you know, I think I also bring a perspective to the committee that, you know, is valuable, in that I work with education programs that are educating the next generation of healthcare professionals. And I'm always looking for ways to improve those programs and looking for ways to partner with people to do so. So that's why I joined.
Thank you, Jason. I appreciate that and appreciate your perspective as well. Any other comments before we move on? Okay, perfect. So we are going to hear about a few updates from OHA and the Oregon Health Policy Board. I know our Oregon Health Policy Board liaison, Brenda Johnson, was not able to be with us this morning. So Mark and I just tagged you, Mark. Mark and I will see if we can give you the rundown on the Oregon Health Policy Board meeting that took place yesterday. And it was a long meeting with a lot of information. Sometimes I think those meetings are information overload. So I need to go back and listen to the recording again and pick up anything that I might have missed. So they did discuss at that meeting, Neelam and Mark were there to talk about the healthcare provider incentive program, some administrative expenses. The board had a couple of questions about some of the expenses for the provider incentive program. And so Mark and Neelam gave a little insight as to that. We also had a presentation regarding the redeterminations and the public health emergency unwinding. If anyone is interested in seeing the PowerPoint from that, we can absolutely share it. Redeterminations are going to start taking place. Members will have a little bit of extra time, if I understand correctly, to respond to the request for the information to be redetermined. And you know, I think we're going to see a lot of people that will come off the Oregon Health Plan. I think as coordinated care organizations, we're preparing for that. But as far as redeterminations go, the first batch of the renewals will begin on April 2nd. So the system will identify everyone that's up for renewal. They will start going through a process of renewal. And there's going to be, which I was really happy to hear, there's going to be a lot of outreach done to these members that will need to go through the redetermination process. I believe there's going to be a lot of reach out, not just these members getting a letter and saying, okay, but, you know, respond. But I think they're going to do some outreach for that, which I'm really happy to hear. And let's see, they're going to be doing that. Mark, did I miss anything on redeterminations? I think I caught it. It's going to be a process, so it's not something that's going to just be taking place in April and it's done. It's going to be a process throughout the year. And I do also want to mention, you know, they are going to have a process in place for return mail. So I was really glad to see that they're going to be doing some outreach to folks if they can't, if they get mail that's been returned. Let's see, Mark.
I have a quick question on that, Laura.
Sure.
Since we're thinking about workforce, will OHA be tackling that all on their own, or will they be collaborating with some of the CCOs to do some of that work? I imagine it's a huge workforce task. And so with my workforce glasses on, does it seem like we have adequate workforce to do that redetermination process this year?
I believe that OHA is going to be hiring quite a few people to help with this process, that and the new waiver implementation as well. I don't know the number of staff, but I do know that they're going to be hiring quite a bit of staff to handle this, because I mean, I think it's something like maybe 1 million, if I remember correctly. Mark, is that about right?
A little over, I think.
Yeah, that's what I thought. You know, and as far as the return mail piece goes, if the return mail comes back, the profile for the member is going to be flagged, and they're going to be doing outreach to that preferred method of contact for those members to make sure that they can get in touch with them, which I was really glad to see, because I've heard in the past, you know, if you know, we do have for our CCO, and I'm sure we're not unique to this, we do have houseless members, and sometimes communication can be a challenge. So very happy to hear that that's going to happen for the outreach. And let's see, anything else, Mark, on that I might have missed?
Just on redeterminations, Laura, I think that was great. I will follow up in the email that gets sent to the committee with the actual presentation from the board meeting, so that as people may have more detailed questions, you've got what was presented to the board and also the point of contact to follow up with. Elena, thanks so much for those questions.
Yeah, this is Coy here, and my understanding that there's sisters throughout the state that have been preparing for this for several months, and Oregon Health Authority is partnering CCOs in funding and supporting some of these sisters. I just saw something on an email from one of our partners, and there's definitely more resources that are coming out to culturally specific organizations, especially for folks who are working with the houseless communities, and folks that don't have a permanent address. That's one of the those are the communities that we're most concerned about as far as missing the deadline and then not necessarily getting their redetermination process completed because of the inability to communicate, OHA's inability to communicate to the participants.
Thank you, Coy. And I don't know if everyone saw Katrina's note in the chat. And she said there's going to be an entire OHA and DHS collaborative that's going to be working on this. And I'm very happy to hear that, Katrina. So thank you for that. Okay, so let's see, what else did we talk about yesterday? There was some discussion around Senate Bill 967. I know that's kind of a hot topic right now, as far as how how the potential reorganization of the quality incentive programs will roll out. There's going to potential for different reorganizations of the metrics and scoring committee. So that bill was presented yesterday. And let's see, we had a presentation from the Health Equity Committee regarding their charter and operations. We did have a legislative update from Dave Baden, an OHA update. I'm sure some of you have heard that our interim OHA director, James Schroeder, has submitted his resignation. And, you know, he just shared that he felt the time commitment that this job was going to entail was not conducive to family life. And it's a big job, takes up a lot of time. And so he submitted his resignation. Dave Baden, who is the Chief Financial Officer for OHA, has been appointed the interim director. And the governor has stated that she started a nationwide search for a new OHA director. So James Schroeder will be in office or in his position until March 17th. And you know, Dave Baden's been at OHA as the CFO for quite a while, so he'll be taking over until we find a permanent director. And let's see, Mark, did you have one more thing you wanted to share?
Laura, that's a great update. I realize that the committee hasn't met actually since before the February Oregon Health Policy Board meeting also, and just wanted to note that at the February meeting, Neelam, Jill, and Leah presented the evaluation of healthcare provider incentive programs. It was really, really well received by the board. The board did, as Laura mentioned, have some follow-up questions on the details and the level of the increase in administrative expenses with regard to the healthcare provider incentive program. And Neelam and I joined the board yesterday to respond to those questions. But that's a great update, Laura. Thanks.
Thanks, Mark. You know, I'll also add that if anybody's looked at how many bills are in session this year, it would make you crazy. There's more than I could even count. You know, and OHA does have some themes this year for their legislative items, you know, of course, in it, eliminating health inequities, stabilizing the behavioral health system, stabilizing the Oregon State hospitals systems, protecting health coverage, which is great because a lot of the elements in the new 1115 waiver address that. Building a post-pandemic public health system, and one of the governor's big initiatives also in one of the themes is promoting and partnering on housing access. So there's a lot of bills that are related to this. There's they gave an update yesterday at the meeting. There's more than I could even count to go through here, and so I don't want to take up the time to do that. And we'll talk a little bit about that a little bit later. So let's see, anything else, Mark, that I missed for the OHPB yesterday? Okay, and I would always, you know, I would encourage committee members, if you have the bandwidth and the time to attend those meetings. Sometimes you can listen in and multitask and do something else. I've probably been listening into those meetings the whole time I've been here, and I learn something every single time I attend. So again, if you have the time and you can listen in on those meetings, they're very, very informative and you'll learn a lot. So thank you for letting us update on that. And let's see, I think I'm going to turn it over to Joe and any of the other OHA primary care office staff to give us some updates of new staff members that have joined. And then we're going to talk a little bit about the how to round 5 advisory committee. So I will turn it over either to Mark or Joe.
Okay, well, there's a pause here while Joe's coming off of mute. I just like to take a moment and really, really welcome Melissa Yates, who will be presenting along with Joe. Melissa is one of the newest members in OHA and the newest member of the primary care office team. I think she may have been 3 days into her tenure in the last meeting, but I don't know that the committee got to meet Melissa, and you'll see and hear a lot more from Melissa in the weeks, months, years ahead with the How To Grant program. But first, Joe Bergeron for leading today's presentation.
Thank you, Mark. Thank you, Laura. And I know Jamie has the slides, and while he's bringing those up, the How To Grant program here, you see on the slides here, the Healthy Oregon Workforce Training Opportunity How To Grant Program Advisory Committee will provide recommendations to the How To Grant program on developing Oregon's healthcare workforce to address shortages across disciplines and expand the culturally and linguistically responsive care in the state. And we just have a couple of slides here. Melissa and I will be sharing just, I'm going to talk about our recruitment process first, and then Melissa's going to provide an update on the next round of funding in the How To Grant program. But first, everybody received the slate of new members for the How To Advisory Committee in your packet. And so I just wanted to provide some background on how we assembled that group of 15 individuals that are on our How To Advisory Committee. We started this out before Melissa came on board in February. We started the recruitment process shortly after I came on board in September with Joe Johnson, who was the previous How To program coordinator. And so I was working with Joe Johnson. She put together our application for the advisory committee. And we initially reached out to the community engagement program coordinator at OHA to discuss the pre-recruitment sort of gap analysis process. That went through that process, looked at the tools available, but that wasn't applicable in this case. We were just going to be having one committee member returning for this new advisory committee. So we proceeded with our application and sent that out to the primary care office email list, which has about 6,900 subscribers. Also sent out our application to the Office of Tribal Affairs, Office of the Governor, Higher Education Coordinating Commission, Oregon Workforce Partnership, and Oregon Workforce and Talent Development Board. So really got the announcement out and had the application open for a month here from November 17th to the December 15th. And then our review committee met to review the applicants. We had, the review committee was 8 of us, included myself and 5 other OHA staff on the Behavioral Health Workforce Initiative team, Daniel Page, Jen Isley, Karen Stockwell, Tim Nesbitt, and Jack Elliott. And then Laura McKean and Bob Lieberman here on the Healthcare Workforce Committee also joined us in reviewing the applicants. We assessed them on a rubric for their interest in the How To program, for their professional background, and for their expertise in racial equity and health equity. And then we ranked the applicants in our review process and extended offers to the top 14 applicants to join our one existing member. And that's how we got to the 15-member slate that you have in your packet. And so next slide, please. We're still collecting the official demographic data on each of the applicants. We can't necessarily use the Oregon Health Policy Board membership survey because it's pretty lengthy and includes a number of questions that aren't relevant to the How To Advisory Committee. So we're working with Joe Johnson and the Diversity and Equity division or equity and inclusion division team to assemble a real D survey that we can use either with Qualtrics or with Microsoft Teams, and we'll be collecting that data in the coming month or two. And then that way we'll have all that data on hand to use in our gap analysis during our next recruitment process, either next year or the following year. But based on the applicants, we know that our applicant pool was very diverse because of the lived experience shared in the application. The committee slate includes representation from communities of color, as well as the LGBTQ community. Next slide. We also have geographic representation from each of the OHPB regions in Oregon, except for Eastern Oregon. Next slide. And then in terms of the professional representation in different career sectors, we have behavioral health providers, community-based organizations, healthcare providers, hospitals and clinics, institutions of higher education, local workforce development boards, and state agencies, all represented among the 15 members on our committee slate here. And then also listed here at the bottom, also wanted to mention that one of our new members is a healthcare workforce committee member, and 3 members are how-to grantees. And on the last slide, I have our contact information for Melissa and me. And I think, Laura, did we need to actually approve the slate at this time, or should we go ahead and get some round 5 update information from Melissa at this time? Or Mark? Should we take questions or anything like that, or maybe get the rest of the information?
I think your presentation was great. It's a great jumping off point to ask the members for questions and then just approve the slate if people are comfortable doing that.
That's what I was thinking too.
Sounds good.
Yeah, committee members, are there any questions or comments for Joe on the slate that has been brought before you?
My only comment or question would be, I know that the healthcare landscape in Eastern Oregon is very unique and different than the other regions on there. So just a comment that in the next recruiting cycle, I think it would be important to intentionally recruit someone from that region. I think otherwise I have no problems with the slate as proposed.
Yeah, thank you, Elena. That is going to be a top priority in our next recruitment.
And Elena, if I could just mention, we've even thought about maybe doing some focused recruitment before the next cycle, recognizing that, this was the first attempt at bringing on members. So we recognize there are gaps, and we want to, we probably won't be able to address them by the first meeting, like, for a tribal member or for someone from Eastern Oregon, but by the next meeting, we'd like to, before the next recruitment cycle opens up.
Awesome, thanks.
Any other questions or comments for Joe? I think I'll just add, Joe, I mean, I know how tough recruitment is sometimes. And it, sometimes things seems like you reach out and you reach out and you reach out and you try to do some targeted improvement, and getting folks to respond is difficult. So I appreciate all the efforts for this.
Thank you.
And I was really glad to be a part of that process.
Yes.
I learned quite a bit, and that was really great.
Yeah, it was great to have you there. Thanks again.
So committee members, can I get a motion to approve the slate for the how-to round 5 advisory committee?
Move that we approve the slate.
And a second?
A second that we approve.
Thank you. And then we'll go ahead and just say all in favor. If you could just put your virtual thumb up or your real thumb up, or say yes, that'd be great. Perfect. Are there any opposed, committee members? Okay. All right, Joe, you have
Okay.
your committee.
Well, thank you. We plan to meet at the end of April is our tentative first meeting for the How To Advisory Committee. But Melissa Yates and I are working closely on everything with the advisory committee. And then Melissa was going to give a short update now on our pending solicitation for the round 5 of funding in the How To grant program.
Okay.
Melissa?
Yeah, thank you, Joe. I appreciate you all taking the time to support the How To program. I'm Melissa Yates. I use she, her pronouns. As Mark mentioned, I just joined OHA last month. So really excited to have the opportunity to work with you all. So we just wanted to give a really quick update so you could have a heads up about the next round of funding that will be coming soon. It's actually waiting for final approval with DOJ. So hopefully we will have an update soon, and that'll get posted on the How To website and shared broadly to begin accepting applications. So applications, once that does post, we'll have a couple info sessions to answer questions about the application process, and then have the application open for 6 weeks before we start review. And that is where we also come to you all. We will be having both OHA and community members that serve as reviewers for that process. So we would be grateful for volunteers. If you're interested in taking part, I'll pop we have a How To shared inbox that I will drop the email into the chat. So if that's something that you might be interested in, we'll know the exact timing once we get that official approval, but it's looking like probably the end of April into June for the reviewer process. So fingers crossed as all of that comes together. But Joe Bergeron and Joe Johnson have put a lot of work into getting that process off the ground and submitted. So we're excited to see that move ahead. Thank you all.
Thanks, Melissa and Joe. And I'll just share, I had the opportunity to be a reviewer, a grant reviewer last year for the How To grants. And I will say that the thoughtfulness and the intent and that went into those applications, I think, all the grant reviewers were very good stewards of the dollars that were available to these organizations that applied. There was a lot of really different applications, different projects that were going to be going on. So we definitely, if anyone is interested in participating in that process, let us know, because it was really it was good to do. Any other questions on the How To slate or process or grant or advisory committee?
Laura, I was just going to invite members of the committee, if you know that you're interested in participating in the review, just go ahead and you can contact Joe, Melissa, the email information that they provided. I'll get their emails into the chat also, or you could just put your direct chat into Joe or Melissa and let them know. And if there's anyone else here who's a guest to be interested in that process, you've got the contact information for Joe and Melissa. Get a head start on that review panel. Thanks.
Thank you, Mark.
And I think if I just to touch on the different applications, if I remember correctly, we had a couple of applications around traditional health worker programs and advancing that. There's actually a couple of oral health how to grant submissions. So again, my oral health colleagues, I was really happy to see that. So it's a great process. So I definitely would encourage folks to, if they would like to participate, to get in touch with us.
Thank you, Laura. I also put the how-to website in the chat box. One of the things I love most about the website is that it lists all 34 grantees that we've had in our previous 4 rounds of funding. So you can see a very nice succinct list of everybody right there on the website and see the diversity of grantees and how they are from all across the state.
Absolutely. And there's some good dollars available for this grant program. So if anybody's interested, please. And Mark put Melissa and Joe's email address in the chat box so you can have it there. So Melissa and Joe, thank you so much for being here. I appreciate it.
Oh, thank you.
Okay, so next on the agenda, we wanted to talk about the healthcare workforce priorities for the next few years. And Jamie, if you could put the graphic up that we have for that. Perfect, thank you. So you can see here we have what we're calling the committee strategic framework. And we have spent quite a bit of time looking at what we're calling our cluster chart and some priorities that we had identified. And here you see we have put kind of put it into 3 buckets. You can see that we have diversity, growth, wellness, and resiliency. And we do have a vision and a mission there that you can see. The vision is, we want a robust and resilient healthcare workforce that provides culturally and linguistically responsive care, meets the local needs of the people experiencing health equities in Oregon. And then the mission is inspire interest, clear the path, support people along their training and career pathways. Thanks, Jamie. And so, we have these 3 categories that are different, but also they're very similar. And I like the Venn diagram kind of graphic there, that because they are all intertwined. And we discussed this quite a bit at our last meeting, committee members. And thank you, Lauren, if you're on the Zoom today, for putting this together. I am not a graphic person, so I really appreciate this, appreciate you doing this. It really helps me it just kind of puts into perspective what we're going to be looking at. It makes it a little bit easier to focus on. So I don't know if Lauren's here, Mark, but many thanks to her for doing this.
We'll be here just a bit later.
Okay, perfect. So committee members, you can see here that we have the 3 boxes on the side: the wellness and resiliency strategies, diversity strategies, and growth strategies. And we were talking at our executive meeting last week, I believe it was, before this committee met today, around this graphic and how the bullets kind of fit into each of the boxes that we have there. And I think, my first impression when I saw it in this format was, okay, we're supposed to be working on health equity and diversity, and we only have 2 bullets in the diversity box. So I know I talked to Mark about that a little bit, and it seems a little, what's the right word I'm looking for? It doesn't seem equal, maybe. I don't even know if that's the right word, but it seems like we have so much in growth strategies and not enough in diversity. And really that's the work that we've been doing around diversity and health equity and resiliency in the workforce. And so when you get down to the growth strategies box, I think there's a couple of things in there that actually could be bucketed into the diversity box. So it kind of made me feel a little bit better about it. But if you go down to the 3rd bullet in the growth strategies, the third bullet says, increase investments in health workers who can provide culturally and linguistically responsive healthcare. In my mind, that could potentially go into the diversity box. It could go in both. My first impression is to maybe move that up to the diversity box. So it makes it a little more equal. And that's not the right word I'm looking for, but I can't think of anything else at the moment. So committee members, this was in your packet, and I wanted to get some feedback from you, have some discussion around this, get your opinion on this. We have been talking about this. This to me, again, puts it into a little more aesthetically pleasing way to absorb this information. So I'm just going to kind of open it up for discussion a little bit, and I would really like to get your thoughts on this strategic framework. And you can either come off mute or, you know, just feel free to come off mute and give us your thoughts. Go ahead, Jason.
So I'll kick things off. By way of context, this is very reminiscent of some conversations we have at PCC around how does diversity fit into healthcare programs? Is it a class, or should it permeate the curriculum at all levels? And where I'm landing on this particular instance is I'm wondering whether the growth strategies and the wellness and resiliency strategies that it makes sense to roll in diversity, equity, and inclusion into all of those, so that instead of having a separate box of diversity strategies, that diversity is in every single bullet in the other two categories, and the language be adapted. You know, like for example, in growth strategies, I think each one of those bullets, all four of those bullets, could be adapted to have language around diverse providers, diverse workforce recruiting, culturally competent or inclusive recruitment strategies. Like, I think maybe rolling it into the other ones might be an option as well. I did a terrible job of explaining that, but
no,
did that make sense? Okay.
That makes sense. It makes sense. So, you know, I think the other thing I was thinking is, do we need to have 3 boxes, or could we have 2 boxes and combine them? They all seemed rather similar to me, and they all seemed like they could fit into more than one bucket. So what do you think about that, Jason? Does that resonate at all, or is that kind of what you're thinking, or are you thinking something different?
Yeah, I was thinking that would, if we permeated all the language with diversity, equity, and inclusion, then we're down to 2 boxes.
Got it.
Okay. And we might even be able to rethink the titles of those 2 boxes, you know, a little bit as well. But I'd love to get other committee members' thoughts on that.
Okay. Dr. Hemmings, I see you have your hand up.
Yes, I just wanted to make a comment about the diversity section. And do we have a definition of, what definition are we using for diversity? Who's included in that? And then the other thing, it's more of a comment that I wanted to say is, you know, I think we need to be sure that we don't say or imply that being culturally and linguistically trained equates to having healthcare providers who resemble and have similar lived experiences as the population, as a community, right? Because those are not necessarily the same thing. And I would say that increasing in the growth section, increasing investment in health workers who can provide cultural linguistic responsive healthcare. I have an issue with that because that doesn't necessarily address the issue of having healthcare workers who resemble and have similar lived experiences. But I would also say that that could also, or some reframing of that could actually also be in diversity. I'm not sure if you are okay with it being in both, but I have an issue with the language, the terminology there.
Yeah, thank you. Yes, thank you for that. And, you know, I think what I was trying to say in the beginning, you just verbalized for me. So I appreciate that. So with that being said, would you have suggestions on how to reframe that or rephrase that?
I mean, I actually would refer to, I think, there's a whole lot of politics around this right now. So I'm trying to be careful how I frame this. But I think there's research out there and data that actually shows that people tend to have better health outcomes when they have healthcare providers who look like them and share similar lived experiences. So I would actually say that, instead of, or in addition to cultural and linguistics, I would actually call it out by actually saying that share similar lived experiences and looks like or resemble, whatever word you want to use there, to the population that they're serving. So I would actually use those two descriptions: resembles, look like, and share similar lived experiences. I would call it out. And that's not in lieu of cultural and linguistic responsive healthcare. It's in addition to.
Okay. Okay, thank you. Let's see, anyone else? I don't see, I'm looking for hands, but again, feel free to come off mute and share your thoughts. We'd like to get as much feedback as we can from committee members.
Hi, and my other point was about how are we defining diversity?
Yes, I wrote that down. Yes,
okay.
Thank you. So let's see, let me pose this question. Is taking into consideration what Dr. Hemming says, does this graphic with these buckets and our diagram there, does it kind of mirror what we've been thinking about as far as a strategic framework? Or are we missing some of the marks that the committee would like to address? Or do you think this comes close to what we're looking at working on for our framework? Any thoughts? I'm not seeing any hands. Does that mean everybody likes it? Okay. Does everyone like this graphic and the way it's laid out? Like I said, for me, it was easier to read, and no offense to your cluster chart, Mark, because it was awesome, or whoever did it, but this is just easier for me to look at, and it's just kind of condensed. So I appreciate you putting all this information and taking the survey results and putting it in this format. Does everyone like this graphic? Again, it kind of goes back to what we think works and doesn't work, and what we would like the committee to look at addressing in the next couple of years. Mark, do you have any comments, questions?
Thank you, Laura. I really appreciate the comments and questions from Jason and Dr. Hemmings. I'd be interested to hear from members whether the vision and the mission seem on target. It sounds like we've got some things to do in terms of the bucketing and the coordination on the right. I'd like to get a temperature check of how close are we on the mission and the vision, and I'm wondering, particularly given Dr. Hemmings' comment, that there may be something, just a little something still missing on the vision, because it does speak to culturally and linguistically responsive care. It doesn't, I don't know that it does, or if it's implied enough, speak to the looks like, resembles, and with common lived experience. So I want to check in on that piece especially. And I see Elena has her hand up also.
Yeah, you read my mind. That's what I was going to say, is adding in a robust and resilient healthcare workforce that resembles the patients they are caring for, or shares lived experience, or maybe both of those, resembles and shares lived experience with the patients they are caring for. We could wordsmith it and get into all the where the commas go, or if it's 2 sentences or 1, because it gets into kind of a run-on sentence. But yeah, I just wanted to make sure that we were reflecting that in the vision, and then yeah, agreeing that the bucketing, to Jason's words, sounds like maybe diversity is over both of them, and how we achieve the diversity looks like some growth, some wellness, and maybe some like recruitment, or there's some third bucket or something. So that's just a ditto, just a big ditto.
Thanks, Elena. Committee members, any other feedback? We'd like to get as much feedback as we can, so please don't be shy about sharing.
I guess I'm kind of stumbling over part of this, just in the arena of inclusivity, like Elena's suggestion. I'm all about lived experience. I said earlier that part of what I look for in my work on this committee is including people with lived experience, traditional health workers, people with lived experience. If we talk about a healthcare workforce that resembles, that makes total sense, and shares lived experience, we're talking about part of the workforce that shares lived experience, not necessarily the entire workforce. Because people may have a provider, they may have a dental provider or a primary care physician. Like my primary care physician grew up in Germany. So we don't have the same lived experience, but he's a really good primary care physician, and we resembled each other, I guess. So I think in the inclusivity, the availability of lived experience and having that be a key part of the workforce, I think is absolutely critical. When we're sending out a vision statement going out to the world, where I stumble is people may misunderstand that. And coming from a rural part of the state, there is misunderstanding about what that kind of thing means. And I hear people criticize OHA for putting out things that they don't understand. So some kind of wordsmithing of that language, I think, in the vision. And I'm curious, Mark, about is this a vision that I mean, if you take what we've talked about over the years, I think all of this captures the general conversation that we've had in this committee. Is this something that we've talked about before? Is this something where you tried to just combine all of that and put this in front of us to respond to?
Bob, I don't think so. Certainly over the years we've done some work, but I don't think so. I think this is a different kind of a moment, honestly, in terms of what's emerged of the last several years since the pandemic, and then the further discussion where you all as a committee were very clear that wellness, resiliency, and diversity were the 2 priorities. That's a different kind of a dynamic than what we've heard before. And I think it does call for real thoughtfulness and making sure that whatever graphic and whatever words are something that the committee can own to speak to what you see we need to do next with regard to the healthcare workforce. Bob, it sounds to me like Mostly the left side of this page is about on target with some adjustments on the vision. We've got some work to do on the right side. And I know Alicia has her hand up also. I'm interested in whether there's a small group of members who'd like to further work with OHA staff and the exec to further refine this and then send it out to the full committee. Bob, did I answer your question about whether this is?
Yeah. And I agree with you, and you're taking all that, Mark. I think my question, I think I didn't state it clearly, is like, who created the language? Was that something staff did? Was that something we talked about in the meeting that I missed? And that was really.
I see. I'm so sorry for missing your question, Bob.
Well, my question wasn't clear, so.
The language on the vision mission came out of a conversation with the exec, with Brenda, Laura, and Paul a couple of weeks back. And then I attempted to reflect that back, and then it was reflected further. So that's where that came from, a little iterative process. And then, of course, the language on the right came almost exclusively from the healthcare workforce needs assessments recommendations themselves. I added compensation into something else in the growth strategy that was not there, but these recommendations largely were lifted from the OSU document.
Thanks for that. I'd like to volunteer to be part of the language. I'm not sure that I can always make meetings or have enough time, but so that's kind of a half-baked volunteering, I guess.
It works, Bob. It's okay.
I stumble a couple other places, like people experiencing health inequities, but we're really for everybody, but we want to call out health inequities. And I think that's something we got to get to also. And again, I'm informed by a conversation I had with the Southern Oregon County Commissioner recently, where speaking to that perception, I think is an important part of our constituency.
Thanks, Bob. Alicia?
Hi, I just wanted to, you guys can hear me, right? Sorry. Okay. I just wanted to further support what Dr. Hemmings had pointed out. I actually just did a presentation to a bunch of resident applicants for OHSU regarding diversity. And I had referenced the Oregon State Health Assessment from 2018 that pulls in a lot of that evidence that specifically supports that providers who are of similar resemblance and lived experiences do provide better healthcare to their patients. And so, everything that was already said, I think Elena said ditto to everything. I would agree in that it really is something I would also echo should be included in the vision statement to specifically call that out, because I was also just looking at the other attachment that was showing the diversity breakdown of some of our other healthcare professionals, such as certified nurse assistants and registered nurses, and looking at the percentage of or lack of diversity in those populations. There's like 60% and 80% of the CNAs and RNs are of Caucasian background, and we don't have a lot of diversity in there. You could have someone who is maybe culturally and linguistically responsive, but that's not something that is the same as someone who's had lived experience and can share that kind of history with their patients to better understand them and what they're going through. So just wanted to echo what Dr. Hemmings had said.
Thank you. So we'll take Dr. Hemmings' comments quickly, and then we'll go ahead and take a break. And I think we'll follow up with folks that are interested. Alicia, I might volunteer you to help us with this. So we'll go ahead and take Dr. Hemmings' comments, and then we'll go ahead and take a quick break and more follow up on this. So Dr. Hemmings, go ahead.
Yeah, hi. I just want to say that, in terms of the wording, it could be and or similar lived experiences. That might be, that's also a possibility.
Thank you for that. So we, if you're interested in participating with us to refine this, if you want to go ahead and just, Mark, do you want that people to put something in the chat?
Virtual hand now, I'll watch, or
Virtual
yeah,
hand.
send something in the chat to me and we'll make sure that you get included.
Okay, perfect. And again, we're
Committee member.
committee members, yes, and we're recording this, so we'll I'll definitely go back and look because I would love to review this again. So thank you everyone for all of the discussion and feedback. You've definitely given us a lot to think about on this, and we'll take those suggestions and get the group together and move forward. So at this point, it's like it's 11, it's about 2 minutes to 11. We'll go ahead and is 10 minutes, Mark. We'll go ahead and take a 10-minute break, and I'll go ahead and reconvene everyone about 11:10. So feel free to turn your cameras off while we're at break and grab some coffee or use the restroom or whatever you'd like to do, and we'll see you back in 10 minutes. committee members, if you are back, if you could please, if possible, just kind of raise your hand or virtual hand or turn on your cameras to know that we're back, that would be great. Okay, I think we have most everybody back. Okay, so we are going to move into our next agenda item, which is a follow-up to the 2023 Healthcare Provider Incentive Evaluation. And to do that with us, we have Neelam, Leah, and Jill. So I will turn it over to whoever is going first for that.
Hi, thank you so much for making time and space in today's meeting to come back to you about the Healthcare Provider Incentive Program and the evaluation report on provider incentives. We had originally presented on the information we had at that time at the January 4th special meeting. There were some changes made to the report, and thank you so much for everyone who reviewed it when we sent it out the end of January, provided additional thoughts and comments, and contributed to then what was you know, as was mentioned at the beginning of the meeting, a really strong report that we got a great deal of appreciation for at the February Oregon Health Policy Board meeting. So we just, you know, we had said that we would return to you to provide an update, in particular around some of the data we couldn't share. So I'm just waiting for the presentation to be pulled up. Thank you so much, Jamie. These, you know, during this presentation, if you can go to the next slide, please, Jamie. We just want to really focus on updates to the report since the January 2023 meeting, special meeting, because we had provided a much more thorough walkthrough of the report, but recognizing that some of the information had changed, and in particular, just in response to some of the feedback we got from you. And in particular, we're going to provide an overview of the data collection and additional highlights, some of the updates made to the Healthcare Provider Incentive Program data, the Behavioral Health Workforce Initiative data, and then take any questions and comments you have. Next slide, please. So this is going to be the overview. Next slide. So this chart, you might recall, shows a summary of everyone who has been touched by the financial incentives that are state funded since 2018 through June 30th, 2022. I recall from our January meeting, there were some questions whether or not there was some duplication. For example, could someone in primary care loan forgiveness also qualify for rural the rural medical practitioner tax credit? So we did some further research and investigation, and there indeed was some duplication. So the numbers of people who receive the incentives through the Healthcare Provider Incentive Program, which includes loan forgiveness, loan repayments, scholarships, the medical malpractice insurance subsidies, as well as the How-To Grant Program, the Behavioral Health Workforce incentives, and then the tax credit is just under 3,600 students and practicing professionals. And you'll see in the footnotes some of the more information about duplicates. Next slide, please. So an update on the data collection that was done for the various incentives on race, ethnicity, and/or language. Those started with some incentives during this reporting period. And that the chart that you see kind of provides a summary of the data collection efforts. So under the Healthcare Provider Incentive Program for loan forgiveness, loan repayment, the Scholars for Healthy Oregon scholarship program that OHSU runs, or SHOE, those 3 programs under the Healthcare Provider Incentive Program collected race and ethnicity data. In addition, loan repayment also collected language data. The behavioral health workforce incentives, the Behavioral Health Workforce Initiative, which launched its loan repayment incentive during this reporting period, also collected race and ethnicity data. And so we recognize that, this is still a work in progress, and we are continuing to work with the data experts from our Equity and Inclusion Division. There's a newly stood up team in the Health Policy and Analytics Division as well, in collaboration with the Office of Rural Health at OHSU to begin collecting data that's compliant with REAL-D standards in 2023. And then in addition, another change, we recognize that there were some small numbers that could allow students and providers to be identified. So we did suppress those to retain the confidentiality of students and practicing professionals. Next slide, please. So, just a few kind of highlights, 2 points we really wanted to raise. We did not collect this information for all incentive recipients, but for those that race and ethnicity data was collected, 34% of students and practicing professionals receiving awards identify as people of color or tribal members. This is a new calculation. Many thanks to Mark for his hard work in helping to develop this estimate on students and practicing professionals that receive loan forgiveness, loan repayment, and scholarship incentives, particularly through the SHOE program, will provide an estimated over 1 million hours of primary care and dental care to almost 440,000 patients. So that gives you some more information about the impact of these investments. Next slide, please. So I'm going to turn it over then to Leah, who's going to walk us through some of the updates in the Healthcare Provider Incentive Program.
Hi, everyone. Good morning. I'm Leah Festa, she, her, and I am the Healthcare Incentives Coordinator. And so, we're going to talk a little more specifically about some of the incentives that we collected race ethnicity for. So if we could go to the next slide. For primary care loan forgiveness, as a brief reminder, this incentive provides students who are enrolled in a rural training track of a participating primary care training program forgivable loans for their tuition and fees. And that's in exchange for a service obligation at an approved practice site. So again, a reminder, this incentive has awarded $2.6 million over 5 annual award cycles to 51 future clinicians. And we began collecting race and ethnicity for this incentive in 2021, so quite recently. With that data, we've estimated almost 36% of recipients of primary care loan forgiveness identify as students of color or from tribal communities. So the bar chart on this slide displays the number of students seeking loan forgiveness, and that has exceeded the available award funding consistently since 2019. And then the table on the left-hand side summarizes the average award amount per recipient by school and their program of study. So most students were enrolled in primary care disciplines with a small proportion in oral health. And of the 23 students who have completed their training so far and their service obligation, all remain in Oregon and 19 continue at their original award site. So some new information we collected. So next slide, we will roll into loan repayment. This incentive awards recipients by repaying their student loan debt in exchange for a service commitment at the qualifying site. So there have been 17 quarterly cycles awarding approximately $16.7 million to 295 practicing clinicians across the state. So of these recipients, 34% identify as people of color or from tribal communities, and 34% speak a second language. And the bar chart on this slide in the top right corner there shows that the number of practicing professionals seeking loan repayment has increased and consistently exceeded the available award funding. So over time, approximately 32% of applicants have been awarded. And as healthcare professionals continue to seek relief from debt burden, we do expect this trend to continue. And then on the left here, you can see we've got loan repayment recipients by race and ethnicity sort of broken down, so you can see a little more detail there. And as a note, Mila mentioned we do have some small numbers, so you'll see we have a range for a couple of the ethnicities. And if you have any questions or want to talk more about that offline, we're happy to kind of go over the different data analysis we've had to do. The next slide. Perfect. This very large table, this incentive it's just showing you this incentive is obligated more than $16.7 million to 295 practicing clinicians in Oregon. And this table provides a summary of the recipients by discipline and award amount. So you'll have these slides in your packet. You can dig more into this as well. But really, we're showing here approximately 39% of recipients are in primary care, 40% are in behavioral health, and 20% are in oral health. Overall, 59 providers out of this 295 have completed their service obligation, and of those, 58 still remain as providers in Oregon, and 50 of them continue at their original award site. So I know that's a mouthful, but basically just demonstrating that this retention in Oregon has been pretty positive. So next slide. All right, our map. We did sort of reorganize this map to accommodate small numbers as well. And it's organized by Oregon Health Policy Board's identified regions. It's showing distribution of our incentive recipients across the state. And so professionals in 33 of 36 counties received awards. This gives you a little idea of the breakdown of where people are residing. The next slide. Again, I know we're going through this really quickly, so please feel free to ask questions afterwards. You get to look a little more. Our last incentive that we did collect race ethnicity for that we want to overview is the Scholars for a Healthy Oregon initiative. This is sometimes referred to as SHOE scholarship. This provides full tuition to OHSU students in 4 clinical programs. In exchange, they agree to a service commitment at a qualifying site. And this one is actually funded to OHSU to administer. So there have been 3 annual award cycles since the funding started running through our healthcare provider incentive fund. And of the 55 students who receive scholarships, 51% identify as people of color or from tribal communities. And overall, 30 students have entered their service obligation. And the table on this slide summarizes those awardees by clinical discipline. And then I'm going to pass it off to Jill with the next slide.
Hi, everyone. I'm Jill Boyd, she, her. I'm also a healthcare provider incentives project coordinator with Leah. And I'm gonna just be providing a couple updates on the behavioral health workforce initiative since our last meeting in January 2023. So just as a brief reminder, there are multiple kind of programs within the behavioral health workforce initiative. There's the behavioral health workforce stability grants to provide providers provide staff compensation and workforce retention and recruitment. But we're going to focus a little bit on the behavioral health workforce update for loan repayment. So if you look back at the slides from January, you'll notice that we have had to kind of make some modifications to the graphs due to the suppression of small numbers for confidentiality of students. But we do have one wave of loan repayment that began in April of 2022. So we've adjusted the table to the right to include the 25 recipient award kind of categories or types. And then again, we did, as Neela mentioned, we did collect race, ethnicity, and language data. And we did have over 1/2 of the recipients identify as people of color or from tribal communities. And then close to 1/4 self-identified as speaking a second language. So just wanted to provide some updates on that for you. And I think we'll go to the next slide. So this is just kind of a brief reminder of the considerations going forward that we will be looking into more based on some of the work and the discussion points that you guys have had, as well as discussion points from the Oregon Health Policy Board. This is just a reminder that we are planning to collect more uniform data and expand the REAL-D sexual orientation and gender identity information, as well as create an anti-racism approach to recruit, support, and retain providers and develop trauma-informed workspaces. And workplaces. We want to consider additional incentives and continue to create new options, additional work around resiliency and well-being. And then we also included that we want to continue to include students and practicing professional experiences, including community-informed data, institutional feedback, and internal review to adjust and evolve our incentives. And then finally, we want to create a more intentional career pathway and advancement opportunities, especially in the certified and uncertified occupations for those who want to remain in the field. So with that, I'm going to turn it back to Neelam, and I think we just have some questions and comments from you all. Thank you.
Yeah, would just really like to, next slide, please, Jamie. Yeah, next one. This is a link to the entire report. There's also a shorter executive summary, which I can, I'll drop both of those links in the chat. This is all of our contact information, and then, you know, would love to hear in case you have any additional questions. And, you know, of course, I really want to thank, it was a large OHA team who worked on this report. So much gratitude to our colleagues across HPA, the Equity and Inclusion Division, and I'm sure I am forgetting some people. And thank you to all of you for asking your really great, insightful questions that helped to improve and make this report a really great baseline that can serve as additional investments are made during this legislative session for future iterations. And then, of course, I'm sorry, Laura, of course, Mark reminded me too, of course, our partners at the Office of Rural Health at OHSU.
Dr. Hemmings, I see you have your hand up. Did you have a question?
Yes, I do. Once again, you know, I'm big on definitions of terms. So how is POC, people of color, being defined on the applications?
Yeah, you know, right now we're using the office of the OMB, or I think it's the Office of Management Budget, the federal definitions for now, until we can launch the Real D data collection tools.
And this is, I'm sorry, I haven't seen the actual application, but that definition is actually on the application, correct? Or,
Yeah.
And then there is a selection box, I'm guessing, that applicants would check off to state where they fit in, how they identify.
You know, I'm going to ask Leah and Mark if you wouldn't mind responding, because you're much more familiar with the application than I am.
Because I'm assuming that's how you get your data to know how many people identify as POC.
It is a self-identification. So we do have people also who decline to state.
Oh, okay.
Yeah. Mm-hmm.
Okay, and how do you count them in your data outcomes if they decline to say?
We did include them in the overall number. So
Okay.
that percentage is the percentage, the denominator includes the overall number.
Okay, got it.
Okay.
Yeah. Yeah. So I wanted to give that person a chance to respond as to whether or not there's a selection box on the application where applicants can self-identify. I'm assuming there is, but I don't know.
Yes, there is. There's the first question is open, so they could write it out if it's very specific how they identify. It asks, how do you identify your race, ethnicity, tribal affiliation, country of origin, or ancestry? And then we have the check all that apply below. And one of those options is, you know, don't know, don't want to answer, or you decline. So they do have the option to complete it or not, depending on how they feel.
And it is page 7 of the 7-page application that Leah provided the link to in the chat.
Okay, great.
And also, in case it was helpful, posted a forwarding link to the current guidelines around defining diversity from the Federal Office of Management and Budget that Neelam referenced.
Great, thank you for that.
Committee members.
I'm sorry.
No, go ahead.
So the reason why I asked about that, because I know in academia, because a lot of these are educational institutions, right? And in academia, there is underrepresented minorities, so URMs, right? So I just wanted to know whether or not how, POC was being defined, because I've seen a lot of different definitions of what a person of color is. So I just want to know which definition were we actually using. So thank you for that.
Yeah. And while I am not the program staff and the expert, I did want to underscore that at this point, we've invited people to self-identify whether or not they identify as a person of color or a member of a tribe. And that as we move to Real D, there will be obviously a much more extensive survey for people to fill out in terms of how they identify.
Great. I just want to make sure that when we're reporting out, data, that we're actually reporting it correctly, and how we're actually gathering that information, that it's correct and it actually reflects the actual applicant pool. I don't know if this was what came up the last time for me, but do we have the total numbers of applicants, how they identified, and how many actually were awarded, right? And do we have any ideas as to those who were not awarded, what contributed to that? Because one of the things I think that I'm thinking about is, are we looking at who we give these awards to and versus who we don't? And are there some inequities around that? And how can we work to kind of address those inequities that exist? So what percentage of, for example, POC applicants are being denied versus non-POC applicants versus rural community, so on and so forth?
I'll jump in just for the sake of time. I think the short answer is yes. Part of the presentation yesterday with the board was kind of the reverse of the number of overall applicants who identified as people of color or members of tribes. I'm sure we can reverse engineer that figure and get directly the answer that you're asking for, Dr. Hemmings, and send that out as a follow-up also.
Thank you. Sounds good.
Yeah, and then Dr. Hemmings, too, really quickly, I wanted to add, we incorporate some of those factors into our scoring rubric as well. So we'd also be happy to send some of that information too.
Thank you.
Perfect. Thank you, Neelam, Leah, and Jill for that update. I really appreciate it. And we're going to go ahead and move right along. We have an update on the Future Ready Oregon with Jennifer and Katrina. So I will go ahead and turn it over to you.
Thank you so much. Good morning, everyone. Jennifer Purcell. I'm the Director for Future Ready Oregon here at the Higher Education Coordinating Commission, and happy to be joined today by Katrina Doty with BOLI. And Katrina is the Healthcare Innovation Specialist at the Apprenticeship and Training Division. Jamie, I understand you'll be driving our slides this morning. We're going to go ahead and dive right into the content and hoping that we can get through the bulk of the slides this morning. And then if we need to come back and visit with you all for follow-up, depending on time, we can certainly do that. Our intention today is to provide you with a brief overview of Senate Bill 1545, also known as Future Ready Oregon. We're going to speak to the early implementation by HEC and BOLI and provide some examples of healthcare related workforce initiatives specifically. And then I hope to spend a little bit of time talking with you about the convening of the statewide healthcare industry consortia and how HEC is approaching assessment and reporting for the investments. Next slide, please. I'll start by taking a quick step back to remind you of the origins of Future Ready Oregon. In 2022, the state legislature passed Senate Bill 1545 that included a comprehensive $200 million package of investments that work together to advance an equitable workforce system. Of course, the disruption created by the pandemic exacerbated an existing workforce crisis and exposed significant disparities in how our systems serve Oregonians, particularly communities of color and other historically underserved and marginalized communities. And Future Ready Oregon really intentionally engages priority populations while advancing education and training programs that lead to employment in key sectors of our economy, which were identified in the bill as healthcare, manufacturing, and technology. And it's really by removing barriers to education and employment and providing wraparound supports and services to education and training participants that we are preparing a diverse workforce that will strengthen Oregon's economy and ensure equitable prosperity into the future. Next slide, please. I keep reaching to advance the slides, but I will let you do that for me. So as we are implementing the Future Ready Oregon investments, we're guided by several core principles. First, investments will work together to impact the entire workforce pipeline, facilitating seamless career-connected learning opportunities. And decision-making, including decisions around funding and policy and process, are all grounded in racial justice and equity, again, focused on serving priority populations and advancing a diverse workforce. It's really these core principles that are at the heart of the sustainability of the Future Ready Oregon investments over time, advancing meaningful and inclusive partnerships and collaboration that are intended to redefine Oregon's workforce education and training system, where employers are actively engaged in identifying and informing high-value credentials and workforce needs, and education and training providers are developing and delivering on those industry-driven, industry-informed credential pathways, and community-based organizations with trusted relationships with priority populations are facilitating recruitment and retention strategies and providing those wraparound supports and services. Next slide, please. Future Ready Oregon combines state general fund and federal ARPA funding to support people with education, training, and resources that they need to get into good paying jobs by leveraging and expanding on existing successful programs, including post-secondary career pathway training programs at our community colleges, credit for prior learning investments, registered apprenticeship and youth programs, while also investing in new and innovative approaches to workforce development, which you'll hear more about related to the Workforce Ready grants, workforce benefits navigators, and statewide industry consortia. Next slide, please. So I'm going to start by speaking to HEC's early implementation of Future Ready Oregon grant programs, which include Prosperity 10,000, Career Pathways, Credit for Prior Learning, and Workforce Ready grants. The general fund investments included in Future Ready were really intended to advance innovation in the short term, leveraging existing relationships, as well as in administrative infrastructure to facilitate immediate outcomes. The general fund investments, of course, have to be spent by the end of the biennium or June of this year. And to date, HEC has obligated all of its nearly $50 million in general fund grant opportunities. In contrast, the federal ARPA funding has to be obligated by the end of 2024 and spent by the end of 2026, which really provides HEC a bit more time to be intentional about investing in new and innovative approaches to workforce and talent development. And these funding opportunities will be available beginning this year on a phased or rolling basis. I'm going to tell you a little bit about each of the grant funded programs and then turn it over to Katrina to talk more about BOLI's work in registered apprenticeship specifically. But next slide, please. First, I'll talk about Prosperity 10,000. Prosperity 10,000 was a $35 million investment in our local workforce development boards. There are 9 local workforce development boards across the state, which are indicated on the slide here. And these investments were really to expand the local board's capacity to provide career coaching services, develop paid training opportunities, and provide scholarships, stipends, and other wraparound supports. The 9 local boards received their first allocation of $15 million in general funds in May of last year, and they will receive their second and final allocation of $20 million in ARPA funding early this year. It's important to note that these investments are not specific to the 3 key sectors prioritized in the legislation. Rather, the local boards are investing in regionally significant workforce needs. And so each of the local boards took a bit of a different approach to investing the first round of their Future Ready Oregon funding. Some of the boards expanded existing relationships and others advanced new partnerships. 8 of the 9 local workforce boards have identified healthcare as a priority sector for their region. You can see those identified here on the slide. And a few examples of the Prosperity 10,000 investments that specifically advance workforce opportunities in the healthcare sector include Clackamas Workforce Partnership, where they're working with NGen Technologies to provide a platform that supports Clackamas area employers and their employees with English language instruction. Willamette Workforce Partnership in Marion County is partnering with Interface Network to train 24 bilingual emergency medical technicians and 40 community health workers. Lane Workforce Partnership is providing scholarships for training programs in healthcare occupations. And the Rogue Workforce Partnership is collaborating with Southern Oregon University to provide comprehensive support to 22 students from underserved populations who are enrolled in a Master in Clinical Mental Health Counseling program. The Southwestern Oregon Workforce Investment Board, or SOWIB, has partnered with Umpqua Community College to support 21 second-year nursing students. They are also partnering with Southwestern Oregon Community College to fund second-year nursing students, pharmacy tech students, and a medical assistant. And as part of the Building Careers in Healthcare program, Work Systems, Inc. is supporting 50 WorkSource Oregon customers to offset the costs associated with prerequisite courses needed to prior to enrolling in healthcare-related training programs. Next slide, please. Community college career pathways programs are education and training programs that are connected to student support services, enabling individuals to secure a job or advance in a high wage, high demand industry or occupation. This was a $14.9 million investment to Oregon's 17 community colleges, really to expand support for students, particularly from priority populations. Next slide, please. Several of the community colleges are expanding post-secondary career pathways programs to advance workforce opportunities in the healthcare sector. A few examples include Columbia Gorge Community College, where they're building and expanding on emergency medical technician, paramedicine, and other health occupations, serving rural and low-income students. Next, Central Oregon Community College is providing instructional support for CTE programs, career and technical education programs, as well as developing programs in integrated education and training and developing new certificate programs, which includes addiction studies, public health, and exercise science. Chemeketa Community College is collaborating with community partners to expand and leverage existing programs and support services, specifically in the CNA field. And they are also leveraging inclusive career advancement programs to serve individuals with disabilities. Mount Hood Community College is expanding their existing career pathways programs, as well as developing new certificates in emergency medical technicians. Oregon Coast Community College is expanding curriculum and faculty training and assessment, particularly in the allied health programs. And Umpqua Community College is expanding career pathways programs, including healthcare and new certificate programs, particularly serving rural and low-income students. Next slide, please. A quick mention about the credit for prior learning grants. This was a $10 million investment that was awarded competitively to 14 community colleges and 5 public universities. Credit for prior learning allows Oregonians to receive credit for the knowledge and skills they gain through work and life experience. That can include military training, significant work experience, as well as formal and informal education and training from institutions of higher education in the United States and in other countries. And credit for prior learning activities are not sector specific, and this investment really expands the opportunities across all academic areas, but I wanted to draw attention to it as it's relevant to our work expanding the healthcare workforce. And next slide, please. The largest investment in Future Ready Oregon was $95 million in Workforce Ready grants. These grants are intended to encourage innovation and broaden the partners that comprise our workforce system. Grants are available to community-based and culturally specific organizations and education and training providers to fund the creation and expansion of education and training programs in the key sectors of healthcare, manufacturing, and technology, as well as to expand the capacity of organizations providing workforce development services and to provide direct benefits to individuals, including stipends for earn and learn experiences, funding to pay for education and training costs, or job readiness supplies, as well as wraparound supports and services like offsetting the costs of transportation or technology or childcare. An initial round of Workforce Ready grant funding was made available for the first $10 million, which accounted for the general fund portion of the investment. The HEC received 146 applications requesting over $70 million in funding. And after a rigorous review and scoring process, we awarded funding to 42 projects to be administered by community-based organizations and workforce service providers across the state. We're currently working closely with awardees to finalize grant agreements and advance project implementation. A full list of the Workforce Ready grant awards is included in our year one report, but the next slide does provide a bit of a insight to the healthcare workforce initiatives included in that. Next slide, please. So the healthcare workforce initiatives include projects that aim to expand and diversify the behavioral health, community health worker, emergency medical services, and direct care workforce. I'll draw your attention to a couple of these. In behavioral health, Poder, Oregon has a plan to increase the number of Latino, bilingual, bicultural mental health providers in Oregon. And Vision Action Network is working with 2 culturally specific community-based organizations to build capacity to provide culturally specific behavioral health services for the Latino, Latinx communities in Washington County, as well as rural areas in the Willamette Valley and Southern Oregon. Community health worker initiatives include the Latino Network's effort to update their culturally specific and Spanish language community health worker curriculum, and Oregon State University's community health worker program is recruiting, training, and supporting job placement for veterans to become entry-level community health workers. Let's see, emergency medical services. The Portland Fire and Rescue Department is launching an EMT certification program, and Mercy Flights is building an EMS apprenticeship program in Southern Oregon. I'll draw your attention to RISE Partnerships Rural Equity Project, where they're advancing the planning and curriculum development for mobile training units that are designed to simulate on-the-job training for the long-term care workforce. And then a couple of other healthcare related projects that were also awarded funding in round 1. The Oregon Center for Nursing is launching a research project designed to uncover barriers to nursing workforce expansion and retention specific to low-income and rural communities. Daisy Chain is hiring 2 doula mentors to support their capacity to mentor incoming doulas. And the Eugene Springfield NAACP is planning and implementing a healthcare career boost, which is a workforce development and mentoring program for students of color to complete high school and higher education programs in the health sciences. Next slide, please. I think for the sake of time, I'd love to come back to this slide to talk a little bit more about how HEC is ensuring inclusive, low barrier grant making processes. But I want to leave time for my colleague, Katrina, to speak to BOLI's implementation of the registered apprenticeships funding. So if you could go to the next slide, please, and I will turn it over to Katrina.
Thank you so much, Jennifer. Hi, everyone. My name is Katrina Dowdy. I use the pronouns she, her, and hers, and I will dive right in. Specifically, I'm hoping to let you know what work we've been able to do at BOLI so far regarding registered apprenticeship, and also just note that as Jennifer was highlighting the different pots of money that are being used to address healthcare workforce needs, that although 20 million of that was set aside for BOLI, and that's what we've been utilizing to bring apprenticeship to a sector where it hadn't been before. I think it's important to note that a lot of the other funding opportunities that have to do with workforce building and education and capacity and equity can also focus on or utilize apprenticeship as a tool to meet those needs. So there's a lot of ways that collaboration can happen as we continue doing this work. Next slide, please. One of the things that I just wanted to touch on, this is where we usually begin presentations when I'm just focusing on the healthcare sector and apprenticeship, is that although we really appreciate this initial investment, and I call it initial because it is just the step, I think that just as it's hard to cram all of this into a few minutes of this presentation, it's incredibly hard to change the hearts, minds, and systems of a sector as in-depth, integrated and thoughtful as healthcare in 1 year. I think legislature knows that. So I think we know it's an initial approach, and it often takes many conversations with me explaining what apprenticeship is, what the core components are, and ultimately how vital a partner community colleges are in ensuring that the equitable pathway of apprenticeship is accessible for folks. One thing I just want to touch on, and I know I've been able to present to this committee before about this, is the reason that we highlight apprenticeship so much is because in other sectors like construction, apprenticeship means that folks engage in their 4-year training program and are paid for the duration of that training. So they receive hands-on skill building time, both in classroom and on the job, and become leaders in their profession while being compensated for their learning. And we find in healthcare, so many folks, especially women and women of color, enter the field and they come with a lot of debt because they've had to pay to learn and then hope for a job that will ensure that they can pay those debts off. So we're really looking at reinventing pathways and collaborating with educational partners like community college to break down some of those barriers and ensure that folks can support themselves and their family all along their journey into healthcare. Next slide, please. And so I know I'm preaching to the choir here, but this is what I utilize when I'm talking to partners and community organizations and healthcare educators as to why this is so vital. And it's not necessarily a scare tactic, but it is a reality of what we're looking at here, which is we see in red what our occupations and our capacity will look like in healthcare with keeping things as the status quo. And we see in blue the need that we will have. And so there is a significant difference there. And one of the things that I really like to highlight is Oregon has created so many projects, programs, and structures, whether it's nursing or community health worker, that are really focused on quality. And apprenticeship has no desire to change that quality, just help create a pathway to get to those same end results that have less barriers for folks, especially as we're having discussions about equity and what our workforce looks like. Next slide, please. And so there's 2 specific careers I would just like to give you a brief highlight of. And actually, this was already mentioned earlier in today's meeting, so I'm grateful to hear it. And so we're just going to be comparing and contrasting 2 positions to show you some of the accessibility points and some of the ways that apprenticeship can hopefully support more diversity in these roles. So we see with CNA here that a bit over half, so 62% of CNAs in the state of Oregon 2 years ago identified as white. We do see a decent ratio of BIPOC and folks of color in the CNA positions. But one of the things that I really like to highlight here is the age. So we see that almost half of CNAs in the state of Oregon are under 35. And that speaks to many folks seeing this as an entry-level position where they can really build knowledges and skills in healthcare, be a really vital component in our long-term care facilities, our hospital systems, our clinical systems, and then decide how they would like to continue to navigate through their healthcare career. Next slide, please. However, we see that that navigation is not happening for a lot of people, especially if their goal is to transition into a position like a registered nurse. So we see almost 85% of registered nurses in the state of Oregon are white. And so as the discussion was happening earlier, it is vital that people are receiving care from individuals with lived experiences and shared identities so that we're really meeting the social determinants of health, providing quality care, and people are feeling like they're cared for in comprehensive ways. The other thing that I just want to highlight here when we're looking at nurses is that a significant portion of our nurses are close to retirement age or could retire at any moment. And so realistically, that's about 28% of our nursing population could decide to retire in the next few years. And we did see that impact, especially during COVID. And so that's one more way that we are alerted looking at this data by saying we need to build more equitable pathways to changing this data, and we need to empower younger folks who are interested in healthcare to see that this is a path that would work for them and something that could sustain them. And so that's really where we're looking at apprenticeship. We've been able to build CNA apprenticeships and medical assistant apprenticeships. And my long-term goal, my pie in the sky goal, my 10-year plan would be to figure out how to create registered nurse apprenticeship programs because we really do see how vital that would be to the healthcare system throughout Oregon and ensuring that we're building those more diverse workforces. Next slide, please. So just a quick overview of some current health sector apprenticeships that we've been able to create here at BOLI. All of these are within the last 2 years, because as I was saying, at this moment, apprenticeship has not been something in the last, let's say, 100 years that healthcare has really utilized as a workforce tool, and something we're seeing is really inspiring people to create those more equitable pathways and build their resilient workforce. We've had great success in creating medical assistant programs with RISE that was mentioned as a partner earlier by Jennifer. We also just had our first qualified mental health associate cohort graduate, which was very exciting. A lot of these programs are in their infancy, and so they still are having their first cohort in progress. Just want to also highlight that some of these are positions that folks think of traditional healthcare jobs, such as CNA, mental health associate. However, I really also want to ensure that when we're having discussions about healthcare workforce, we're talking about comprehensive social determinants of health that really affect who shows up to our emergency room, who receives care from their primary care. And some of those things include early childhood education and EMS services like firefighting. And so we are seeing with early childhood education that it's often not incorporated in people's perception of healthcare. And we're finding that's a missed opportunity in our communities, especially because those are often the folks that are administering childhood medications, that are changing feeding tubes and doing all kinds of health services for our little ones. We're also finding that folks that are wanting to do apprenticeships often need childcare and can't find enough. So we're really creating our own problems, and we're working now on figuring out how to solve our own problems by building and intentionally believing that early childhood education is an essential part of healthcare. Next slide, please. And so just a little idea here of what we're looking at as far as some of our apprenticeship programs. You'll see two, the certified nursing assistant and the medical assistant, have pretty wide-reaching capacity throughout the state, whereas the red lines are really showing you more specific programs that are having a regional impact. such as our certified pharmacy tech program, which we're very excited about. Next slide, please. And so just a few things that I want to let you know I'm really excited on. I started this position in September, and since September have been able to dream big with partners and really reinvent what our idea of healthcare is, ensure that we're all on the same path as far as equity, and figure out ways that we can address some really significant healthcare situations, let's say, especially maternal mortality is one thing we're talking about, and that has huge implications, especially as far as equity and folks of color having higher rates of maternal mortality. And so in talking with community, they identified that there are decent opportunities to become a doula, but the transition from doula to midwife is very, very hard, especially for folks of color, because it is so much unpaid labor. And so we're trying to figure out how do we create a midwifery apprenticeship program. And so our first step is a doula apprenticeship program that folks can join in if they don't already have that status. And we're in progress with that, which is really exciting. And we have an applicant this next round who is hoping to take that on. We also have folks that are interested in specific LGBTQIA2S+ mental health peer support, cannabis healthcare technician. And one of the things I'm most excited about is there was some legislative, not federal, legislative changes that created a new pathway so that surgical technicians could actually utilize apprenticeship models to reach that certification. Until that moment, folks only had 2 programs that they could utilize statewide. And it made it so that folks could not enter an operating room and have on-the-job training until they had that certification. So it was all classroom-based, which is fine, but we know that can present a lot of barriers for folks, especially in our rural communities that want to do that work. So we're excited about building those programs. And especially over the last few years with COVID, we identified that there's a huge need for medical lab technicians here in Oregon. There are only 2 programs in the entire state that create medical lab technicians. And so we are working with PCC, very excited to see you here, Jason, to figure out how to partner with rural health centers. First is Santiam, to create the possibility of having an MLT apprenticeship program so we can partner with our community college collaborators and have that on-the-job training happen in a more rural hospital. And so we're really excited about the idea of showing folks that the satellite program can work, where you partner with a community college that already offers that certification and that route. And then those labs and that on-the-job training can happen in a satellite site, such as a Santiam hospital, an Eastern Oregon hospital, an Eastern Oregon clinic. And that I think is going to be a really good roadmap for us to use for surgical technician and beyond. Next slide, please. And so this is just an idea of who has been involved in Future Ready Oregon already. And so folks that have been approved and are working diligently on their plans include a licensed practical nurse, which is actually RISE partnership, certified alcohol and drug counselor, as well as cannabis healthcare technician. And then we do have other folks focused on dental, medical lab tech that I mentioned that are in the queue and in the process of being reviewed and hopefully approved soon. Next slide, please. And so just a little moment about what I do, because we know that right now this work is limited duration, and we know that Future Ready Oregon had very specific starting and ending dates, and that this is a step in the direction of creating apprenticeship and having it be involved in the healthcare sector. And so it's been really wonderful to have the opportunity to bring my 15 years of experience in many different healthcare settings to the table, reach out to partners and help introduce them to the idea of apprenticeship and start building those bridges. I've been able to be a part of a lot of the grant application developments and help guide partners through the understanding of what apprenticeship is, because it really is a different language. It is a program and set of language skills that were created with construction in mind. And so we're simultaneously, I'm able to teach BOLI how to be flexible and learn healthcare language, and then teach healthcare partners how to be flexible and learn apprenticeship language, and we're all learning together. But right now, my position is until June of this year, and we're finding that our grant partners are excited not only for the opportunity to apply for these grants, but to keep learning more. And I'm grateful that our team at BOLI believes in this work and is determined to continue creating these apprenticeships regardless of FRO or not. Next slide, please. And then just real quick, I am part of the innovation specialist team. I am the healthcare specialist, but we do have someone focused in manufacturing, Stephanie, and someone focused on construction and emerging industries, Kimberly. And so together we are the FRO team that is focused on these apprenticeship goals. Next slide, please. And then it's back to Jennifer.
Thanks, Katrina. I think for the sake of time, I'm just going to do a quick flyover of the balance of our slides, and then we can turn it back to the group. We did skip over a slide that does have some lessons learned as we've been implementing inclusive, low barrier grant making processes that advance opportunities for organizations that may be new to the workforce system. I encourage folks to look back at those. As we begin the new year, we're looking at advancing our ARPA funded program investments, and those include the next round of Workforce Ready grant opportunities, which should be available this month. We are also preparing to launch our Workforce Benefits Navigator program. And then next slide, please. We are preparing to stand up statewide industry consortia that will convene industry leaders, employers, labor organizations, education and training providers, and community-based organizations to really better understand what are the workforce needs in each of the key sectors identified in the bill, and what are our education and training assets, and where may there be gaps or opportunities that we can really invest strategically to address those. Next slide, please. There are a couple of slides in the deck that speak to HEC's approach to assessment, accountability, and continuous improvement. I will just note that in December, we submitted the year one report. You can go ahead and go to the next slide. The first annual report is available on the HEC's website and really focuses on the early implementation of the Future Ready Oregon investments across all 8 of those program buckets that you saw in sort of the spider web of funding slide earlier in the deck. So I encourage you to take a look at that. And then in future years, we're beginning the process of collecting participant data for the grant-funded projects, and we expect to be analyzing those and speaking more to participation and employment outcomes. Next slide, please. So for the sake of time, I will go ahead and wrap up here and just draw your attention to those last few slides for more information. But I do offer to come back to the group if there's additional conversation or we want to dig into some of those buckets further, particularly thinking about the healthcare industry consortia, which we expect to be standing up in the next several weeks, probably April, and chat with you all about how best to coordinate the work of that body with the work of this body. I think next slide is just questions and discussion. So thank you. I'll turn it back over to you.
Thank you, Jennifer and Katrina. That was a lot of information. I just want to thank you guys for the presentation and all of the data and information that was shared with us. I know we're running a little short on time. Did we have questions for the presenters? If we only have until 12:30, if we have a lot of questions, we can absolutely answer them, do an email question and answer session. If there's something really really important and burning that somebody would like an answer to now, they can we can do that. Otherwise, we'll go ahead and Jennifer and Katrina, I believe your email was on the presentation, so we can address it if we have to.
I have a quick question that doesn't have to be answered here, but at some point. How are culturally and linguistically specific organizations being determined? And when it comes to the CNA to RN, CNA, LPN, RN pipeline, how are we introducing the idea of being an RN versus being a CNA, especially to people who identify as Black, Latina, OX, Indigenous? It's kind of unrealistic to think that CNAs are usually paid hourly, to think that they're going to be able to actually do the work of a CNA plus go to school at the same time to get their RN. So I'm just wondering about that. And the last time I checked, when it comes to behavioral health providers, within the Latino population, there's 6 times the numbers of people who identify as Latino who need mental health services versus providers who identify as Latina. So I think it's like 2.2% of the population are Latina behavioral health providers, and there's about 12% in the population.
I would love to just quickly address the question about community-based and culturally specific organizations, and then maybe Katrina and I can follow up offline with the more specific questions. Senate Bill 1545 included 10 priority populations, and there is also a definition of community-based and culturally specific organization included in the bill. But I will just tell you from a practical perspective, much of what we have learned through the Technical Advisory Committee and those that have been informing the grant-making processes is the ability to demonstrate a cultural competency in serving one of those priority populations. So those include communities of color, they include women, veterans, individuals with disabilities, rural Oregonians, and I should never start down the list because then I will forget one, but they are defined in the bill, and our application asks that culturally specific organizations speak to their cultural competency in serving the priority population they've identified.
Thank you, Jennifer. And just to add on to that answer, we also are working on ensuring that that this bill is the floor, not the ceiling. So for example, the floor uses terminology like cultural competency, and we know that you can't actually be competent in another person's culture. And so cultural humility is really where we're going, and the goal there. And then I do just want to highlight that one of the questions that you were addressing was about how difficult it could be in reality for someone to have a job in healthcare and be pursuing another job in healthcare. And that is why we're highlighting apprenticeship, because apprenticeship is paid education. So it would be removing the idea that someone has to have a secondary job while pursuing that education. So for example, if someone did the medical apprenticeship program, medical assistant, they would be paid for that learning. And then if they want to then transition into, let's say there's a nursing apprenticeship, they would be being paid while doing that program. And so that's why we're talking about those equitable components and those outcomes, is because you are very correct. There are so many barriers and privileges that come with being someone being able to do nursing school and not have a job simultaneously.
Thank you. I'll put my follow-up questions in the chat. Thanks.
That's awesome. Thank you, Dr. Hemmings. And again, Jennifer and Katrina, thank you very much for that. We're going to just shift the agenda a little bit. We're going to turn it over to Judy Guzman-Cottrell with Public Health at OHA. Judy, I apologize, we haven't left you too much time, but we'll go ahead and try and get through your update and presentation.
That's okay. Thank you so much for the time on the agenda. Mark, do you want me to share my slides, or what do you want to do?
We are prepared to do that here. Jamie's going to share the slide deck. It's coming right up. Judy.
Thanks so much. I just dropped in the chat a link that's going to be related to my presentation. So in the interest of time, I'll go ahead and get started and just introduce myself. I'm Dr. Judy Guzman-Cottrell. By training, I'm a pediatric infectious disease physician, and I've been here in Oregon for about 19 years as a clinician. I also spend part of my time working as a contracted consultant and subject matter expert for Oregon, for the OHA Healthcare Associated Infection Program. So this is a program, a standalone program within the OHA infrastructure that focuses on collaborating with clinicians and facilities to decrease the risk of patients getting infections from their healthcare. So what I'm going to be talking about today, just in for a few minutes, is the administrative requirements for infection prevention education for Oregon's healthcare students. Next slide, please. So just if you haven't heard about OHA's HAI program before, again, we're focusing on the healthcare associated infection prevention for patients as they seek healthcare, and for employees, staff, healthcare workers, and visitors as they're in healthcare facilities. This just gives you a very kind of bird's eye view of all of the different activities that they do, both in HAI and AR, which is trying to prevent antibiotic resistance development in our state of Oregon and in all of our facilities. So I'm not going to go through all of the categories, but just to show you, this team does a lot of work with healthcare facilities. Next slide, please. So I'm going to be focusing specifically on this OAR 409 or 030-0230. And this focuses on infection prevention education requirements for Oregon's healthcare students. So based on this OAR, which I have a screenshot of down below at the bottom of the slide, healthcare student education curriculums are required to include infection prevention material or education to these students. And you can see here, if you actually looked at this OAR on the website on the health policy and analytics chapter, and you scroll down, then you can see in this little second insert here, I highlighted them in red, that it also requires federal OSHA recommended safety guidelines, including 2 topics that are specific to infection prevention. One of them is personal protective equipment, or PPE, what we wear like gowns, gloves, masks when we're taking care of contagious patients, and then infection prevention practices. And that's the only line in the OAR. And as you can see above, it does reference federal OSHA recommended safety guidelines. Now in the Zoom chat, I gave you a link to the OSHA infectious disease website. So that's the only reference that all of the healthcare education leaders in Oregon have to reference to meet this OAR standard. Next slide, please. So before I talk a little bit more about this, I want to give a step back and give a little background of why I'm here. So Project First Line is a new program, educational program that was started by the CDC. It's the CDC's National Training Collaborative, and the goal is to provide infection prevention education to all healthcare workers, no matter what their role is, in all types of facilities across actually all 50 states, including Oregon. So I'm the medical director of Oregon's Project First Line, and OHA's HAI program. We recently launched Oregon Project First Line. Next slide, please. So one of the goals of our Oregon Project First Line team is to collaborate with all 17 Oregon community colleges and meet with their education leaders. I'm trying to understand the current landscape of healthcare student infection prevention education and determine how we, our Project First Line team, can support these educators who teach infection prevention fundamentals to Oregon's future healthcare workers. When I met with two nursing leaders from one of the community colleges, they were the ones that actually told me about this OAR. And they said, you know what? We don't know if we're meeting the intended expectations for this Oregon OAR for our students. We would really like to have more details, because when we look at this OSHA website, there's just too much information there. Next slide. So this OAR, again, it references federal OSHA recommended safety guidelines, including infection prevention practices. It's very vague, very broad. I put it already in the chat, the federal link. I also looked at the Oregon OSHA infection prevention contents, and these are really more focused on the employers and occupational health topics and more regulatory guidance, including how they should be documenting and doing surveillance for healthcare personnel hazards. And the link is provided there as well. Next slide. So really our assessment when we talk to these community college education leaders and our HAI experts and our Project First Line team looked at this, our conclusion, our assessment was that this OAR references OSHA for infection prevention contents, but unfortunately the contents of these websites, both federal and Oregon, are very broad. And we see this as an opportunity to provide clarity in the requirements of what really should be happening around infection control education and competency for Oregon's healthcare students. Next slide. So discussion points that I'd like to raise are, how can our HAI program and our Project First Line team help to support educators across the state to meet this training requirement? How can our program work with this committee to clarify how educators in schools can meet this requirement? And then just in general, how can our team lend our expertise for future rulemaking? One thing that we thought we would be able to potentially offer in, adjunctive to this OAR is for our subject matter experts to create potentially maybe a checklist of objectives that educators can use. And if they can check everything off that list, then they know that their students are receiving at least the minimal competency or objectives to meet this OAR. And with that, next slide, I'll stop there. My email is there. Rebecca Pierce is the manager of the HAI program. Unfortunately, she was pulled to a different meeting, so I'm here on behalf of both of us. I'll stop there. Thanks so much.
Thank you, Judy, for that. And committee members, if you have questions for Dr. Guzman, if you could please reach out to her by email or get a hold of Mark and myself, that would be great. And we have just a couple of minutes left for just a quick legislative crosswalk. Are we going to do that, Mark?
We are. We are. Lauren Neely, our graduate intern, is here. I'd like to just say like maybe 30 seconds, Laura, in terms of the follow-up to Dr. Guzman-Cottrell's presentation. We really appreciate Dr. Guzman-Cottrell coming to us. Neelam, John, myself met a couple of times with her and colleagues. And what we will be doing is initiating a work group to review OAR 409-036, which is actually in the rule intended to be in existence, and it's not in existence. We're going to begin recruitment, and we're going to be coming back to the Workforce Committee at its next meeting around how that recruitment is proceeded. and then we'll launch from there. But we really appreciate our colleagues in public health bringing this particular item to our attention to more systemically address the broader array of clinical training standards.
Thank you, Mark. Thank you again, Dr. Guzman-Cottrell. That was really great. Lauren is here. I wanted to let everyone know Philip Schmidt was going to be here to give us a more in-depth legislative overview, but he had to attend and testify at a hearing. So Lauren is here, and we have a couple minutes, and she's just going to go through a quick crosswalk for us, and then we'll wrap up.
Yeah, okay. I'm Lauren, and I am a graduate intern with the office for this academic year. And so this is like a summary of all the workforce bills that we are currently tracking, and that have to do with the healthcare workforce. So just to explain it a little bit, across the top row is the columns and their titles. So if you start with subject matter, that's going to be the categories that these bills are broken into. And then within some of these categories, there's subcategories, like under new workforce development programs, there's behavioral health, oral health, nursing, physician, those types of categories. And then we have the bill number, topic, which is just a brief overview of the bill, chief sponsors. And then the next batch of columns are going to be topics that the bills are related to. So there's new incentive programs aligned with HB 2949, which is the expansion of the behavioral health workforce, and then goes on a little bit more about healthcare provider incentive program, physical health, oral health, behavioral health. And then the last column is addressing the needs identified in the 2023 healthcare workforce needs assessment. And then the last column on the right is the committee and status. So current, and they're broken up a little bit. So current is where the bill is currently at. Subcommittee is if it's been if it's in a subcommittee, and then status is the most recent action related to the bill, whether that's a public hearing, work session, or if it's been passed, that would go in there too. If there's amendment to that, I'll add a line that says amendment and the number of the amendment. And all the way at the very bottom, because I know it's a very long document, is a legend that kind of explains each of the columns a little more, as well if you get lost or want more information. Oh, and then I did just update this yesterday, I think. So this is the most updated version.
I just would like to say, Lauren, thank you so much for managing the sheet and developing the sheet. And as I just put in the chat, we will send out to all the members this updated version of the sheet that Lauren has assembled. And you can use that to pay attention to bills. We really, really appreciate the resource that this is as we go through a dynamic legislative process. Lauren, thank you.
Thanks. Absolutely. Thanks, Lauren. Okay, a couple of things to wrap up. Thank you, everyone, for being here and hanging with us for a couple of extra minutes. Thank you to all the presenters and all the great information. For those of you that are going to be helping us with the small group, we'll look for a time within the next few weeks, maybe 60 to 90 minutes, and we'll reach out to you with that. And then the last thing I wanted to mention is the 40th Annual Rural Health Conference is coming up. They are now, excuse me, accepting proposals for that. I just threw the link in there. Conference is going to be in October. Would like to see some great proposals for those of you that would like to submit any. And with that, we will go ahead and adjourn the meeting. Thank you for everyone, and we'll see you next month. Have a good day.